I started my menses on my uncle's wedding. Yeah. And the night before, it was extremely painful. So I was ashamed, in pain, in a wedding celebration, all so nicely dressed and stained.
Well, thank you and welcome back to this podcast, Beyond Condition. Today I am joined by one person. I don't know. Can you be this unlucky? Can anyone in the world be this unlucky? Because last time I was with you, you were talking about opioids. And here we are. We're just finishing a powerful month of endometriosis. And here you are, a person who's gone through it. Trish Baraza, how unlucky are you?
Uh, for the bad times, maybe I'm unlucky, but for all the other good times,
Yeah.
I have a pretty good life. Yeah.
So take me to that day. Like, how did you find out that you actually have this condition that is quite a painful one?
The diagnosis or from the very beginning?
From the very beginning, just how did you find out? Like, when did it show up ever in your life?
So this is a condition that I have had to work with through since I started my menses. And I remember I started my menses on my uncle's wedding. Yeah. And the night before, it was extremely painful. And we had guests over, people had come from up country. And my dad was overseeing this huge project church. So we had so much room for everyone, a polytechnic. So we could host everyone. It was like enough for a hotel with enough room.
So this is your uncle, and is this the first time you attending a wedding? Have you been to other weddings? How does this wedding look like? What was special about this wedding?
I'd actually been to so many weddings because my dad, being the church minister, were always flower girls to weddings with my sister. God rest her soul, she passed on. So this was just one of the many weddings where I was a flower girl and beautifully dressed and all glammed up. But this one was different. I was 12, and that's the day I started my periods. Very, very painful periods, and a painful journey that I have had to live through, and looking back, ignoring and hiding, just the same way it was ignored and hidden on that particular wedding day.
I mean, it must be hard for you on such a wonderful day. Maybe you are wearing white and people are dancing, and here you are, you have your periods, and these periods are not just normal periods. And this is probably one of the ways many people, many girls have actually discovered that they actually had this condition, endometriosis. But for your experience, just this very moment, looking back, what did it mean to you?
I had no idea what periods were. I lived in that era when no one talked about periods openly, except for the biology class, which sort of just painted a picture of womanhood and reproduction. So when I got my periods, I was afraid. And yet I was in so much pain. And I was young, and I didn't even have anything as close as a pad. So I was ashamed, in pain, in a wedding celebration, all so nicely dressed and stained.
Wow, that must have been a very long day. So fast forward. I mean, this at this time probably people are thinking this is just another maybe excess bleeding or excess menstrual. Somebody who has heavy menses. At what point do you now discover that this was actually endometriosis? How do you discover this?
So this becomes my life. Every other 4, 5, 7 days since 12. I am thrown into extreme pain, and I am ashamed, and I have to learn as I grow up that this is something natural that happens with women. And I even think the pain is natural. I think it's very normal, but no one talks about it. So I don't know until around the age of 25, because this is in 2005 now. And this is pain I go through. And remember, we've talked about the other comorbidities or multimorbidities, the other conditions I live with. So until this doctor who walks in and points a finger at it and brings it to question, I would never have known that there was anything wrong with me. It was all very normal.
So you have lived with this pain for almost another 13 years, because now you are 25.
Yes.
And have you discussed it with your parents or your sisters, asking them, how come I have no pain? Or it looks normal to you all these 13 years?
It's a normal occurrence all these 13 years. From that very first time, and from my auntie covering me with a cardigan around my waist, and me finally being introduced to sanitary pads, because I was a public spectacle that day. Everyone knew I had started my periods. So the obvious thing was introduce her to pads. But nobody ever got to know how much pain I would go through every other cycle. And I thought it was absolutely normal.
So for the benefit of the viewer of this podcast, how do you diagnose endometriosis? And are there some tests that are run? Is it a condition that also affects men? Is it just a female condition? And how do you describe this pain for somebody who maybe have more menses today that would want to know if they're having endometriosis or just normal menses? What are the telltale signs?
So endometriosis has to be diagnosed first clinically. That is how you are presenting. You talk about the pain, perhaps the heavy menses, and the bloating, the nausea that comes with it, the difficulty defecating, the difficulty going for short call, urinating, pain during sex. And these are things which, until a medical practitioner that is well-versed has this discussion with you, you're likely to go undiagnosed. And then, most importantly, endometriosis has to be diagnosed through surgery. That's the only definitive way to diagnose endometriosis, because until you're able to get a sample of that tissue and have the same tested in a laboratory as they do in a medical biopsy and prove it to be endometrial tissue, then there's no other definitive way of diagnosing a woman with endometriosis. The rest is just a clinical assessment. And for me, in 2005, March, at the age of 25, I had my first surgery and definitive diagnosis of endometriosis by Professor Koigi Wakamau, a well-renowned gynecologist whom I thank God for till date.
Is that the only surgery that you've had? Or there was another one?
Sadly, not. I have had 4 surgeries. 2 have been for endometrial resection, the one in 2005 and the one I had last year, 2023. And then I have had surgery to remove adhesions, which have been caused by endometriosis, and I've had surgery to remove endometrial cysts, or chocolate cysts, as they are commonly referred to in the medical lingo. And the symptoms are mostly pain around the pelvic region. But remember, endometrial tissue in endometriosis can line itself anywhere else. and you can present with fevers and pain, and you can also present with infections, because where the tissue embeds itself is where it's not supposed to be. Because when it lines the inside of the uterus, then you will be able, it has an outlet, you'll be able to release it during your menses. But when this tissue happens anywhere else, including your rectal area, including in the vaginal canal, including in your bladder, in your bowels, and God rest her soul, in the case of Njambi Koikai, in her lungs, there is nowhere to let out this tissue as it breaks off, as does the uterine lining during your menses. So you will just suffer inflammation, suffer pain, suffer infection, suffer a dysfunctioning system, a malfunctioning system. You won't defecate well. You will have pain. You will have pain going for short call urinating. You will have pain during sex. And these are things no one wants to talk about.
Is there a reason why it only affects women and not men?
It doesn't affect men, although there are some documented cases of men who are transgender. And some of these things may happen in some cases which cannot be described, but this is a condition that affects women. And it affects women, and there is an incidence of it affecting women after menopause. So you can't restrict it to happening only during childbearing periods. So the misconception that menopause will cure endometriosis needs to be debunked. Yeah, and busted.
It's one thing to have a condition that you know the cause and the cure or the treatment. Here you have a situation whereby you are dealing with endometriosis that there's no known cause. How do you deal with such a situation?
Well, until I knew better, I may have thought I have been bewitched. But now I know that I am 1 out of 10. There are some of us out there who will suffer endometriosis as I am and as I have suffered. So you just take it as it comes. I take it as it comes. And I know that with every other cycle, things may go haywire for me. I may be in pain. And I may have to run to hospital. I may get admitted.
Let's talk about the treatment side of it. How expensive is it? Is it drugs? Is it injection? How is it handled just to manage it?
So there are various treatments that you'll be given to sort of manage the symptoms and give you relief or some reprieve through the years. And that's happened to me. And one of them is surgery. Surgery is not a cure. It's just management of endometriosis. And but it does last you. It can last you 5 years. It can last you 10 years. But I know women who've had surgeries between 9 months. Then the other non-treatments include hormonal treatments like GnRH agonists. Those are technical things. But I have used these injections, and one injection costs anything between 21,000 to 30,000. And you're supposed to take this injection monthly for perhaps a period of 6 months. And a lot of times insurance won't cover this.
NHIF doesn't cover this condition, does it?
NHIF insurance rarely cover hormonal treatments.
Okay.
Yeah. If you go out there and you need hormonal treatments, and I have even in the recent past, NHIF won't cover. There's progesterone hormones. It comes in pills, 21-day pills. NHIF won't cover it. Insurance won't cover it. So patients have to fork this out of their insurance. There are some insurance companies that allow for exceptions, but most insurance companies out there won't cover you. And if you do not have insurance cover, you're on your own. You have to get this out of your pockets.
Wow.
And we also have contraceptives. They also assist. You also have the Depo-Provera, the injections, and all this, come with a lot of side effects. Yeah.
So you're dealing with endometriosis, and then there comes another condition.
Adenomyosis.
Now, what is this?
So adenomyosis and endometriosis are like twins. And sadly, some of us live with both. I live with both. So endometriosis is endometrial tissue depositing itself outside of the uterus, uterine lining, the inside, which comes out and bleeds off as menses. Adenomyosis, the uterus as it is, that wall that makes that sac, in the case of adenomyosis, the endometrial tissue is inside that wall of the uterine cavity. If it's a bag, look at the wall of that bag. The endometrial tissue is inside that wall. So it's not where it's supposed to be, but it is now inside the wall. And with adenomyosis, and it's a twin to endometriosis, the only cure is removing your uterus. They can debulk your uterus. It gives you a rigid and enlarged uterus because of the deposits, and it keeps enlarging. It causes you pain. It will affect your nerves. It will also affect all the other processes around the pelvic region. And the only cure, as I have been informed up until now, is to have your uterus removed.
Wow, I don't want to ask you if you plan to have a uterus removed.
Yeah, it's something that I am having to consider.
Yeah.
Because adenomyosis can push you to a place where, and it has done that to me, I sometimes have periods exceeding 2 weeks.
Wow.
Yeah.
So this story of yours, I mean, what do you want to achieve as you tell it to other maybe ladies or women out there who might be going through this condition?
I'm breaking the shame, because it's worse enough to suffer the pain. You don't need to suffer the shame. These are topics that are shrouded with a lot of secrecy and taboo. No one wants to discuss menstruation because it's not something that happens in the open. But I would like the world to know that 1 in every 10 women lives with endometriosis, secretly, quietly, shamefully, and painfully. And if you're one of those women, please do not be ashamed to seek support. It will push you to a place where you will doubt yourself, and so will the medical doctors who do not understand the condition because they are not as informed. It will push you to doubt your sanity because of what you're going through. It will make you normalize pain. And I would like to break all this and to support you to seek treatment, to support you to know that these abnormalities happen within normal women like myself. And in as much as no one is talking about it, I have come out to talk about it. It is now being seen to lead to deaths because it can affect different organs that mean life and death, including lungs. And I also just want women out there to be held with compassion by community, in a community that now knows that there are women out there who do not live with normal menses like everyone else.
Thank you, Trish. Viewers, you've heard it. This is a story of stain of pain, the story of Trish Baraza journeying with endometriosis. As you've heard, 10% of women are actually affected by this condition, and some are suffering in silence. And it's time to break the shame and to speak up so that action can be taken. I've been your host, Paul Wafula.
And I've been your guests, Trish Barasa.
Thank you. See you.
Bye.
Like, share, comment, and let us know how you felt about this podcast. Thank you.
Thank you.